Welcome to my channel. In this video, I will discuss postpartum hemorrhage. What is postpartum hemorrhage? It is also called PPH, and it is a condition when a woman has heavy bleeding after giving birth. It is a very serious but rare condition, and it is the leading cause of maternal death. It usually happens within 1 day of giving birth, but it can happen up to 12 weeks after having a baby. Incidence is 1 to 5 in 100 women who have a baby have PPH. Here you can see risk factors for postpartum hemorrhage. These are, first one is antepartum hemorrhage. What is antepartum hemorrhage? Hemorrhage that occurs from 20th week of gestation up to the delivery. Then augmented labor, then chorioamnionitis, infection of the membranes surrounding the fetus, then fetal macrosomia, maternal anemia. Maternal anemia along with PPH is a life-threatening condition. Maternal obesity, multifetal gestation, preeclampsia, primiparity, and prolonged labor. So these are risk factors for postpartum hemorrhage. Signs and symptoms are vaginal bleeding is visible outside either as a slow trickle like drops or a copious flow. Rarely this bleeding is concealed, either remaining inside the uterovesical canal or in the surrounding tissue, resulting in hematoma. So when hematoma is formed, this bleeding is concealed. But as we know that when hematoma is formed, the clotting factors are utilized and the bleeding tendency in that woman is also increased. Then there is enlarged uterus. As it fills the blood or blood clot, it feels boggy on palpation, that is soft and distended, and it is atonic. Here you can see the algorithm for postpartum hemorrhage management, that is hemostasis. Hemostasis. H stands for ask for help, and you have hands on uterus. Give uterine massage. A to assess and resuscitate. E to establish etiology, ensure availability of blood and ecbolics. M stands for massaging uterus. O stands for oxytocin infusion or giving prostaglandins, either IV, IM or per rectal. S stands for shift to theater aortic pressure or anti-shock garment or bimanual compression. Then T stands for tamponade balloon or uterine packing after exclusion of tissue and trauma. This tamponade balloon actually distends the uterus, and as a result, after distension, the uterine contraction occurs. A stands for apply compression sutures, beeling or modified. S stands for systematic pelvic devascularization or uterine ovarian, quadruple or internal iliac. I stands for interventional radiology and, if appropriate, uterine artery embolization, and S stands for subtotal or total abdominal hysterectomy. This is this is the last line of treatment, and if all these treatments fail to stop bleeding, then hysterectomy is done. So hemostasis is the algorithm for management of postpartum hemorrhage. Here you can see first line therapy, uterotonic agents, oxytocin, ergotalcaloids, prostaglandins, and second line of therapy is surgical interventions, for example, artery ligation, radiological embolization, and hemostatic drugs, for example, tranexamic acid. And last line of treatment is hysterectomy. What is this? Hysterectomy. What is hysterectomy? Hysterectomy is removal of uterus.